I remember you telling me about numbness and tingling. There's a lot of people that have numbness and tingling in their hands. Most commonly, people get it in the thumb, the index finger, the middle finger, maybe sometimes this finger. That's by far the most common, and that's carpal tunnel. What's interesting about what you told me was that your numbness and tingling is in a different place. You have numbness and tingling in the small finger and this side of the ring finger, which is a little less common, and most people have not heard of this problem, but you actually have cubital tunnel syndrome. And it's not a pinched nerve at your wrist, it's a pinched nerve up here at your elbow, on the inside of your elbow. Now, ultimately, the problem involved here is that your nerve is going to go through a tunnel at the elbow, just like your median nerve here is going to go through a tunnel at your wrist. But in that tunnel, it is so tight that it's creating too much pressure on the nerve. There's actually little blood vessels that travel right through the middle of the nerve, and those blood vessels are pinched off. So your nerve at the position of your elbow or at the position of your wrist is not getting the appropriate blood flow. And when that happens, it starts to malfunction. And the symptoms that you might be experiencing are numbness, tingling, a little achy pain. It's usually vague. It's kind of diffuse. You can experience cramping. You might experience radiating pain up your forearm. Sometimes that pain might seem more along this side of your arm, extending all the way up to your elbow. You might describe weakness, dropping objects, early fatigue. You might wake up in the middle of the night with a hand that feels completely numb and achy and painful. And you might even tell me a history of, hey, I had to shake my hand out or hang it over the side of the bed to get my numbness and tingling to go away. These are all very common complaints. But as I said before, your numbness is in the small finger and in the ring finger, and that's not carpal tunnel syndrome, that's cubital tunnel syndrome. So these two fingers are typically most affected by the nerve that gets pinched at your elbow, and it's positional. When your elbow is bent, you're pinching that nerve more, and these two fingers are going to fall asleep faster. Perhaps you have noticed that when you're talking on the phone, these two fingers fall asleep. And the way you need to treat it is you need to switch hands, put your arm out, get your elbow straight, shake it out, and typically the severity of that numbness and tingling will go away. Now, if you do have these symptoms and you're having these symptoms every day, you may have an actual medical and surgical problem. And the first steps that you'd want to do are, number one, come tell me about it. But secondly, you want to try activity modification, keeping your elbows as straight as you can. You want to take some Advil or Aleve, which is an anti-inflammatory. It's not necessarily for pain, which is what most people think that medication's for, but it's really more to decrease the swelling and inflammation around the nerve, which will improve blood flow. When that happens, usually the numbness and tingling gets a little bit less severe. And then ultimately, there's a sleeve or a splint that you can wear on your elbow at night. We call it a pillow splint. And it keeps your elbow straight when you're sleeping so that you don't sleep with your elbow bent and your hand bent and then wake up with numbness and pain in the middle of the night. Now let's say you've done all that and you're still having symptoms every day. Then it's really time to come see me. What we're going to do is we're going to order a nerve conduction study, which will help confirm that you have that diagnosis. We'll perform a physical exam. But if you do have that diagnosis and your symptoms remain persistent, you're ultimately going to need a cubital tunnel release, which is a little cut right here on the inside of your elbow. We open up the tunnel to free up that nerve, and typically over several months to a year, the symptoms of numbness and tingling will go away.